And we are live. Yes, so the feed is coming up on YouTube as well. I just verified. So I'll start with the webinar. I see that 25 people are watching in and the numbers are slowly trickling in. So thank you very much for joining today. Good evening, everyone. I am Dr. Rajkumar. I represent the Society for Healthcare Simulation in India. And this is the first follow-up webinar following our very successful SimulCon 2021. And with us is someone who's been very, very supportive of SimulCon right from its inception. She's come to India all the way for the first SimulCon. She's part of the SimulCon last year, and she's also conducted a workshop this year. And with her, she brings a team of experts from Hull Institute of Simulation and Learning. Dr. Makani Purva is Chief Medical Officer and Consultant Obstetric Anesthetist at Hull Teaching Hospitals, UK. She was the founder director of simulation at Hull Institute of Learning and Simulation, the largest simulation center in Yorkshire. Dr. Purva is past president of Association of Simulator Practice in Healthcare in the UK, commonly called ASPE, and is the lead author of the first simulation standards in the UK. She's also currently helping us set up the simulation standards for the SHS India. She also developed the accreditation process to enable self, program, and organizational accreditation. She was one of the first to establish a postgraduate MSc course in simulation in collaboration with Hull University. She's an honorary reader at Hull York Medical School and was also on the editorial board of VMJ STEL. Her research publications focus primarily on in situ simulation modalities, curriculum mapping using simulation, and use of simulation to reduce learning curve. Without further ado, over to you, ma'am. You can introduce your team and start your program.
Thank you, Rajkumar. And now on the editorial board of the International Journal of Healthcare Simulation, which is our journal as well. So that's the other thing I think I forgot to put in my profile, and a little plug for our own journal. So good. Welcome, everybody.
I'm sorry to interrupt the flow. People, if you have any questions, please type in the chat box. The YouTube live chat is enabled. You can type your questions and we will present it to the speaker at the end. Thank you.
Thank you, Rajkumar. Thank you for the wonderful introduction, and good evening to everybody from a very cold and windy city of Hull in the UK. We are delighted to be here with you. We are hoping to give you a presentation on what we consider are the top tips and advice that we can give from three of our important members, including myself, because we started our journey in simulation 20 years ago, and our own center is over 10 years old. And you can see some of the pictures in our backdrop, and we'll have a video and more pictures as well as the presentation goes along. But what I think we are hoping to give you in the next 30 minutes is the advice and the tips that we have learned from our experience of setting up a big simulation center. We are hoping that this presentation will be at the start of the journey for some of you. It might be that there are experienced people in this audience who might also be able to share their advice and tips. And this webinar, I hope, will be a very useful place and a starting point for simulation enthusiasts in India. So I'm going to ask my colleagues to introduce themselves, but first what we're going to do is to share with you a bit of an overview of how this program is going to run. 30 minutes is what we hope this presentation will be. And so there's going to be plenty of time for questions at the end. And hopefully there'll be a bit of interaction at that point as well. So if I can ask Irene Kesifiki to introduce herself first, please.
Hello, I'm Irene. I'm one of the consultants in acute internal medicine in Hull University Teaching Hospitals. I'm one of the deputy directors in HILS, having worked with Dr. Purva for over a decade now. And I'm one of the training program directors of acute medicine in Yorkshire. Thank you for having me today.
Thank you. Donna Major.
Good evening, I'm Donna Major. I'm the manager for the Simulation Centre in Hull. I'm also the manager for Learning and Development, and I am the ASPE coordinator. So I look after accreditation and things, which we'll tell you a little bit more as we go through the presentation. So happy to join you this evening. Thank you.
Thank you. And Donna is going to help us with getting our presentation started. We're going to take turns in talking to you through this presentation. So I'll start with the first slide. Marvelous. Excellent. So it's very important for us to also share with you our website details. So there you have www.thehills.org.uk. And we're also quite active on Twitter as well. So another opportunity for you to follow us and to see what activities we're up to. Okay, and the second slide will give us the link or the details of our of the three of us, which we've already done. And then we'll move on to the next slide, which is just a quick disclosure. So we do run a simulation consultancy. We provide guidance to others. This has been both national within the UK and international as well. We have fellows who visit us from all over the world who spend time with us. During COVID, it has been less so. We've done more virtual connections. But prior to that, we had fellows, technical staff, clinicians, non-clinicians coming and spending periods of time ranging from a few weeks to a few months to learn how to set up a sim center, to develop their own skills as well. So that's disclosure of our commercial connection as well. Okay, the next slide, please. So the aims of the session. So there are three objectives we want to reach out to you and hopefully give you an understanding of the resources to consider when setting up a facility. We want to share with you the knowledge that faculty development programs should provide, and also what is the continuing profession development for faculty. And the third is, and I think this is very, very important, is the basic overview on management and sustainability of a facility. One thing I will say is that when you look at a simulation center, the most important building blocks for your center are a good, competent faculty. So faculty, whatever time and resources you invest in your faculty will come back to reap a lot of dividends for you. And that is why when we talk about resources, an important part of the resources faculty. A very important part of this session will also be looking at what your activity should be. And of course, underpinning all of that is an important aspect is how do you manage the simulation center? How do you lead the simulation center? What is the financial viability of the center? Because I think that's a challenge that almost everybody in India will face today. On the one hand, the Medical Society of India and the Department of Health and the Simulation Society are all working together to embed simulation within your curriculum. Postgraduate medicine has also moved into recognizing the importance of simulation. And I know the nursing curriculums and other curriculums in India are also embedding simulation. So you have to do all of that, but you also have to recognize that it costs money. You have to maintain your faculty, you have to retain it, and there has to be some amount of return on investment. And that is why all of this is what we're going to discuss in this session. A little bit about our institute itself. We established the Hull Institute of Learning and Simulation in 2001. I was the founder director at that time. And since then, Hills has grown. It is the largest simulation center in Yorkshire. It is one of the simulation centers which has been very successful in recruiting simulation fellows. We have had nearly 40 fellows over a period of the last 10 to 12 years. And this has been a considerable achievement on our part, because what we have established is that the reputation, which allows us to attract very senior medical professionals who come and spend time with us, sometimes up to a year through their fellowship, and they go back and establish simulation centers, simulation activities, run faculty development programs in their own hospitals, in their own community areas, and actually sometimes in areas where there has been no simulation previously. So over the years, we have been responsible for simulation being embedded across the UK and perhaps in certain parts of the world as well. So we are proud that simulation has not only just been our own passion, but also we have instilled this passion in others as well. We're also perhaps the one organization which also supports people with getting accreditation. Donna will talk a little bit more about it in one of our slides, but we were the first center in the country to get accreditation with ASPE, which is our national body for simulation. So we have a huge amount of experience, and hopefully that experience will shine through this presentation and hopefully answer some of your questions towards the end as well. Next slide. Over to you, Irene.
So one of the first things, the first tip you need to make sure you have worked out before establishing your center is faculty development. And that has two things to think about. Number one, how many faculty you will need within a projection of 1 year, of 2 years, of 5 years, depending on what your activity will look like, and how to train them. And in terms of training, you need to give a baseline training of your faculty. You need to make sure they attend specific courses. And after that, you need to maintain a way that they keep themselves up to date. So to make that a little bit more easy to understand, I'll give you an example of how we train our faculty. So at baseline, we give our faculty, all of them, a train the trainers in simulation. This is a baseline training course. It's usually 1 day, full day course intense, but it can be a 2-day course depending on the needs. And it is an introduction of simulation and an introduction of basic educational concepts and theory around simulation-based medical education. We analyze the current evidence, we analyze best practice in simulation, and we go into practicing scenario scripting and course development. So that's the basic thing I think every center should be able to do, or outsource for somebody else to train the faculty, basically train the trainers. Then the faculty that you will want to run simulation courses, especially high fidelity ones that probably you'll be envisaging having in your centers, is giving them a debriefers workshop. The debriefer workshop we are running in the center, what we do is we train them in the correct techniques of debrief, and then we do lots of practicing on debrief them on their debrief again and again and again until they excel in the debriefing technique. So after that, it depends on whether you want permanent faculty or faculty that will help you in one type of course, or faculty that will help you in procedural courses or high fidelity simulation courses. But if we are talking about full debriefers training, you probably have to create a program like the one we have currently in HILS. So what we have in our center, we take our fellows and we create a target list based on a spiral curriculum type of pool. We break all our targets into small parts, and then we apply mastery learning. For example, I take one fellow on Monday and I ask them to see me, observe me, debriefing a specific scenario in simulation. And then their task is next time, after analyzing what I did, to join in with me on a debriefing the same scenario. And their task for next time is to lead the debrief of that specific scenario. And then the next task is me to debrief the debriefer of that scenario. And then we build on that on a whole course, on a whole series of courses, until they become independent in running their own course. So probably a program like that, you might think of either establishing yourselves in the center to develop faculty, or if it's too much to start off with, outsourcing that to other centers. Now, that is for general for faculty, teaching them on how to get involved in simulation. If you are talking about permanent faculty that you want to invest on them for the next decade or more, you probably need to do what we do for permanent faculty, that we essentially need them to have a diploma or master's in simulation-based medical education. This is what all our permanent faculty have in HILS Center. And that is for good standard training. In simulation specifically, you can't have negative effect if you are not training your faculty. Now, after that, you need to think of the ways, planning ahead, how to keep your faculty up to date. Peer review, there would be like an accreditation process within your center, there would be a collaboration with other centers, but you have to have a way that they keep themselves formally up to date with current evidence simulation and different practices along the world. I think I'm ready for the next slide. So activity, yes, very important to think of what your activity, what the activity of the center you want to look like. And that is not immediate activity. Maybe you need to think of activity ahead in the next decade so that you can plan your resources and especially your faculty very carefully. So that will entirely depend on what you want this center to run. It will depend on your training needs analysis. Do you want to create a center that will facilitate undergraduate education for doctors to be, or do you want a center that will facilitate postgraduate and undergraduate, multi-professional? So it entirely depends on what your needs of your organization are. So who is your audience? What environment do they work in? What skills is it that they need to take home with them? And that based on these two questions, who is your audience and what gap do you want to cover with simulation? Answering these questions will be very straightforward and easy then to plan what courses do you need to provide. For example, do you want to train a single-based organization, your anesthetist to put central lines? That's a whole different need, like planning of a center rather than whole teams, crisis resource management, on how teams work together under stressful scenarios. You need different resources, you need different faculty, you need different investment. So in order to plan for your resources within the next like 1 or 2 or 10 years, you need to do a good and in-depth training needs analysis. Why do you need this center to be there? Do you even need a center to run your simulations? Why not build a center just for the sake of building a center, which is something commonly seen across the world. Sometimes there is the money that they build a center and then they do not know what to do with that or how to utilize the resources. So do your needs analysis, make sure you know why you're building the center, what purpose will it fulfill, what training needs are there in your organization, your region, your country, and then plan your faculty and your resources carefully. I think I'm ready for the next slide. I think it's connected to this. Yes, curriculum mapping. So very important. Now I'm sure you're all familiar with curriculum mapping of courses or training schemes into something that's already established that needs to be there. If you want a little bit of an example of curriculum mapping on a big scale using evidence, I've shared a very good example of how Dr. Purva some years ago cooperated with Health Education in England and joined Royal College of Physicians in England in order to embed simulation in the currently existing curriculum that has been there for years in England. So have a read through. I think it's the first link I've shared on the chat for everyone to see. It's a great example of how she used the evidence already existing at the time in simulation and combined it with the needs in training that we had across the UK in junior doctors in medicine. So something to think about when planning, mapping your courses into the curriculum that already exists for you. So, and the last thing is you need to have a way planned ahead of how to evaluate of what you are delivering. The programs, for example, in our center, we had a program that was fit for purpose for 10 years, but then curricula changed, job descriptions changed within the hospitals in England, and we had to go back, as we do every year almost for our courses. Is this course still fit for purpose? We decided it was not. We involved stakeholders and we created new courses based on simulation. So yes, evaluating quality and planning ahead on how you're going to do that and how often you're going to do that, depending on your courses, is a very important thing to think of before establishing your center, because resources will depend on that. And the last bit mentioned there, I've already touched upon that. So I'm sure you will find a way of qualifying and training your faculty. There are two bits there afterwards, the most difficult ones: maintaining your faculty, sustaining a good pool of faculty that reliably can teach on your courses, and establishing ways that they can keep themselves up to date, or you can reassure that they keep themselves up to date and they deliver what you want them to deliver. I think I'm done. Any questions on the chat, I'm happy to answer in the end.
Thank you, Irene. So over to me now. Just move the slides on. Okay, so when you've carried out your training needs analysis and you've got a really good idea of what curriculum you need to provide, you need to start thinking about your environment and where that simulation will take place. So as Dr. Peva alluded to, we started our simulation journey in 2001, but it was in 2010 to 11 when we was lucky enough to have a centre built. So we originally started off just in one room, and as simulation grew more popular within our own organisation, we needed that expansion, and we were lucky enough to be to have now a dedicated simulation centre. And I will show you some photos and discuss those environments in a moment as well. But as I say, we did start off in a room, so I know sometimes at the start of the journey the finances aren't always there, and it is a case to build it up and prove that you do need that extra space. So you'll start thinking about what sort of resources that you need, what types of rooms based on the audience that you're delivering the training to. How will you store all of the kit? Because when you start to put your list together, you realise there's an enormous amount of kit that you do need. And start to think about transportation even just between rooms in the centre. And that, as I say, will all depend on the results of your training need analysis. So I've got some photos here for you. If you do Google us, the Hull Institute of Learning and Simulation, it will bring up a 360-degree tour. So these images here, you can actually swivel around and see the centre. So here's our dedicated centre. So the blue level, the top level, is our simulation centre. And the floors beneath us is actually our eye hospital outpatients. So we do, as I say, we live in the top floor up there. And as I say, you can see the foyer there as well. Moving on, so based on our training needs analysis, this highlighted that we needed an operating theatre. So the first picture you can see there is our simulated operating theatre. It's very much like it would be in the real world. We've got an anaesthetic area, prep area, and we've also got a storeroom for theatre consumables. Lying there on the operating table is our SimMan 3G, and alongside that we've got an anaesthetic machine. So you can see we've also got a ward. We have 2 4-bedded ward areas that we can quickly change to paediatric or adult, depending on the scenario that we're running. And we also have a 2-bed recovery bay. So when we're doing a simulation in the theatre, we can follow the journey from theatre for the transfer of the patient onto the recovery bay. So I have put up a picture there of our dental simulation lab, because we've had to adapt over time. So depending on what our curriculum requires, our rooms also change to meet that demand. So we used to be the one of the leads in the region for dental training, and we've still got links, but that has moved more to Leeds. But we're very experienced in the setup of dental labs and the running of that as well. So going from the bottom, so we've got seminar rooms. So these are important to have a venue for the debriefing and lecture-based courses that you'll run as well. And we have cameras all over our centre. So we've got a SMOT system, which means that we can run simulation in one room, and then we can have delegates watching from the seminar, so that you've got not everybody crowding in one room, which can be distracting for the candidates on the course as well. So the next picture there is our control room. So our centre is set up to be completely wireless. So we can run simulation in any of those environments that you can see there, and it can all be controlled from this one venue. it controls all of the mannequins from there. And we've got two-way mirrored glass for the theatre and the recovery bay, which can be used for assessment as well if you're running OSCE style sessions. And the last picture that I've put on there is our resuscitation training room. So that's set up with resuscitation mannequins. We've got crash trolleys in there, and you can see seating for the seminar as well. So we're quite lucky enough to have some of the large rooms there. And at this point, I'm just going to quickly transfer over and just show you a video of our Train the Trainers in simulation. It'll just give you a little idea of the centre and some of the resources, and it might just start making you think about some of the roles that you might want within simulation as well. So I'll just share this video with you now. Just bear with me 1 second.
Planning simulation seemed like a huge task, but by breaking it down into its component parts, you can ensure that each stage is well prepared.
In simulation, there are many roles to consider, each playing an integral part in the running of the scenario.
We hope that trainers has given you an idea of how simulation works, and we'd like you to be able to take this away and hopefully get some ideas for your own specialties.
Okay, so thank you. So hopefully that's given you a little bit.
Advertising on YouTube helps me reach engaged customers like Jenna,
Sorry, just
who's
bear
been
with me
searching
1
for
second.
landscapers on Google. So when she watches YouTube,
Sorry about that. Okay, so hopefully that video gave you a a little glimpse into our centre and a little taster of our Train the Trainers course, which Irene was explaining earlier as well. So we will share the link to that video and to our YouTube channel, actually, where you'll find some useful videos on there. So we'll get that link across to you as well. Okay, so I'll go back to the presentation now. Okay, so hopefully everybody can see that. So thinking about the equipment, you'll start to think about what equipment is required. So for the centre setup, you can imagine, as you've seen in the video, it's a lot of technology that we've got. You've got to think about all of the resources, make it as realistic as possible, base it on your own clinical areas, your wards, your theatres, and as I say, make it as realistic as you can. You've also got to decide whether you will need high fidelity mannequins because they're very expensive. And with the mannequins is also the maintenance of them. So the cost of the mannequins, you've got to prepare that the maintenance side of it will be 10% of the cost of that. And that's each year. So they are expensive to run. So you might want to consider whether some of your simulation will be lower fidelity. We use mixed fidelity in Hull. So we use a lot of the part task trainers as well. So I'm just conscious of the time, so I'm just going to move on to the management and leadership. So when you're starting to think about who will lead and coordinate your simulation activities, so every centre has a different structure. A lot of that does depend on the financial arrangements. And within our own centre in Hull, we do have a director and 2 deputy directors. We have myself managing the service. We've got a team of administrators that look after the courses and the setup of the centre. We have a team of educators who are backed by a strong team of directors in delivering the courses. We have a technician and some apprentice technicians for that future planning, succession planning, because the technicians do learn how to operate all of the mannequins and work with our educators to do that. We work with simulated patients, so we have a pool of actors that we bring in for our scenario work. And we also have people that are able to do moulage. So for trauma courses, we make them as realistic as possible. We put makeup on our actors and our mannequins and really try to make it as realistic as we can. So you need to think about the other key stakeholders that you need to engage with. So we have the General Medical Council, and you will have your own equivalents that you need to engage with. Also early on, it's important to engage with your departmental leads and heads of service to make sure that you have their backing. They do help to create some of the content and to provide faculty for the sessions. So we do need to make sure that we engage with those individuals as well. Companies that offer funding grants, so often companies do pop up in terms of giving money for technology and to develop new courses. So we try to keep engaged with those companies as well, so that when there are opportunities, we're ready to bid and hopefully be successful with that. And we also work with other education institutions. And I suppose that in doing that, because we've expanded our service, we've now outgrown the simulation centre that we have. So we're putting in a proposal for a larger centre, but we also now work with our university in the hope that we can share their simulation resources as well. And we work with schools and colleges to engage students from an early age, hoping that we can entice them into a career within the NHS. And we do this by getting them involved in scenarios. Okay. So I've just put a link there, which I'll share in the chat shortly, but it is on our website that we've shared. So you can access our strategy, which we do as a whole team. We involve everybody, the course administrators, down to our technicians. And as a team, we come up with our future planning, strategy setting. And I'm just going to quickly go over some of the management data because I'm just conscious that we're going to lose some of the interactive time as well. So in terms of what data should you keep, so from day one of opening our centre, we've kept statistics on our learners. So as of the 31st of January this year, we'd taught 65,953 learners. And I've popped in a graph there so you can see it was growing each year. And then COVID struck, which reduced our visitor numbers dramatically. We're just starting to build on that again. So hopefully we'll get back up to those numbers that we were seeing. So definitely keep learners. And when it comes to things like doing bids and your return on investments and the costings for your programs, it's very useful to know how many people are actually visiting the centre. And also the types of learners. So we know that we've got a good range of so student nurses right through to different professions, and your consultants, we can do a split on who's accessing our service. Activity as well, we keep records of what courses we've run and the feedback on that. So we evaluate that and we'll use that for our cost effectiveness planning. So we know what courses we're delivering, we're able to work out the cost of those programs, how many people we're delivering it to. And that helps obviously for our budget planning. So we aim to be fully self-sustainable. So we are an income generating centre. We try not to rely on budgets from our trust. So in doing that, we do provide free training to our internal colleagues, but then because we do external generate, we run large national courses, we run conferences, we work with other centres, other educational institutions, and we do generate income from that. So we're able to cover our expenses from the income that we generate. Okay. And I'm just going to hand over to Dr. Perver for quality assurance now.
Thank you, Donna. So I think an important final aspect of our presentation is where would you want to be in 2 years' time, in 5 years' time, in 10 years' time? For those of you who are about to set up your simulation center or are in the early stages, I think it's useful to also appreciate the importance of quality assuring what you are planning to do. And if you embed that quality assurance right at the start of your journey, then it becomes part of your everyday life. And that's exactly what we've done at HILS. So everything we do, we have gathered the evidence that we are delivering it according to certain standards. We have got evaluation where and obviously we're not perfect, we have to improve. So it's been a continual evaluation and improvement process. So what I think we would call as continuing quality improvement. And that has actually helped us to be the first center in the country to be accredited. Now, why is accreditation important? Accreditation is important. Yes, it is important because your reputational advantages, because if you are going to become a center of excellence for teaching, training, if you want your medical school, your nursing school to be well known, then your simulation center should also be of a high standard. If you have a body where you can apply for accreditation, you want to be able to, from day one, be able to achieve those standards. So it's very important that you gather evidence as you go along. You need to be aware of what it is that you require in order to achieve quality assurance. And therefore, this is something that I would encourage you to think from day one. And there are 3 types of accreditation that ASPE provides. Accreditation for the faculty, accreditation for the activity, and accreditation for the resources. So it starts from individuals. So each one of you who are simulation educators, and I assume many of you attending this webinar will be simulation educators. So you yourself should apply for quality assurance for accreditation. Then the programs that you run, and then obviously your whole sim center, and that is the final. It's the ultimate goal, I think, for any simulation center. And if you actually look at our website, it tells you how it happens. And as I explained to you, if you start from day one, then it is very easy to gather the evidence. There is an application process. If it is for individuals, it's just an application process. For the center, it is a panel visit. So somebody from the central body comes and visits. But I think what is important, and Donna sits on that accreditation panel, and along with me, we have visited centers. And I've had the privilege of doing some international accreditation visits as well. So it's really important, I think, to aim for that. And that's something that I would encourage you to do. And hopefully the Simulation Society of India will have its own standards and its accreditation that all of you can be applying for. And then the final slide, which is just the final slide from us before I finish, is something that we at Hills provide, and we call this as our bronze, silver, and gold and platinum package, where essentially we help simulation centers to go through the process of setting up a center. How do you do faculty development? How do you apply for accreditation? How do you sustain it? How do you do return on investment? All those sort of things. And so I hope over the last 30 to 35 minutes, we have given you a good overview of what you need in order to set up your simulation center. And hopefully some of the resources that we've shared with you will also come of use. So thank you for listening, and happy to take some questions. Rajkumar, do you want me to pick up on a few
I've sent
things?
in 4 questions. You can just maybe add your comments on those questions, which I've sent to the chat box.
Okay, so shall I just verbally say that, or how do you want me to do? I can verbally
would be fine,
respond.
Verbally would be fine. Yes.
I had started typing the answer, but okay.
I think you could put that as well. I'm sure there will be a overlap between what I'm saying and what you have as well. So one of the questions, I think one of the first questions was about return on investment. How can you, I think if I, so that was the first question. How to develop a cost-effective sim lab. I think it goes back to the points that we've already raised, which is about making sure that you have a training needs analysis right at the start. And I think this training needs analysis is the key to making it cost effective. Because one of the problems you have is, and Donna referred to it as, you have expensive sim centers. And this is not just in India, but even in the UK, which have been set up and are not being used. So what I think you need to do is to identify what are your programs. Secondly, to then identify who is your target audience. And then more importantly, deliver a package that is adequately funded by the organization that is asking you to run these programs. So that is something which is very, very important. So very early on in our journey, we recognized that Health Education England needed some courses to be run for both their undergraduate and postgraduate trainees. And what we did was we offered to run it for the entire region. So what we did was we costed it up, and we asked the Health Education England if they would be able to pay for it. And they did. And now 10 years on, we are the center which provides not only for that particular program, but we've got several other programs as well, which helped us to set up a sim center in the very early stages to produce some sustainability. So one lesson I would share with you is to recognize that everything you do has a cost, and therefore you need to have a return on investment right from day one. So identifying your stakeholders, identifying who are the people it will benefit, and therefore are most willing to pay the money for it is a very important starting point. Now, there is another element of the cost effectiveness is how can you translate benefits in simulation? Because there are 3 areas where you can demonstrate benefit. One is by the benefit that you can show from your learners when they attend the sim center. Straight away you do your pre-course, post-course feedback, and that will provide you some improvement in their knowledge levels. The second is an improvement in their behaviors. So when they go back to the real world, they actually take it and change their behaviors. And the third is an improvement in patient outcomes. Now, you've got to capture all of these things, because that is the other way. If you are attached to a hospital, you can convince them that you're not just a center that provides just a few programs for improving knowledge, but you can also improve patient outcomes. And that is very important, because all your centers will be linked with litigation organizations, And if you're able to show that by improving patient outcomes, you can reduce litigation, improve patient safety, reduce complaints, and increase patient satisfaction, then the organization to which you are supplying your programs will be willing to pay you money for training their doctors, nurses, and other healthcare professionals. So it is about capturing what it is that you want your target audience and your target organizations want, and then writing a business case around it, which makes your program and your center viable. We have a separate webinar on return on investment, but I've just tried to condense that into about 5 minutes, which is quite difficult. We could do a return on investment on a separate occasion, I think. Anything you want to add, Donna, to it, Irene, to that particular question? Okay. There was another question on the fidelity. Now, the fidelity, the question was curious to know why high fidelity can't be low cost. Absolutely right. I mean, don't get me started on it. I think one thing I've recognized, I mean, so when we started our SIM center, we were lucky to have all the high fidelity, and Donna will remember this. I mean, people are queuing up to give us the technologically savvy mannequins. So name it, we have it. We have probably close to £1 million worth of mannequins in our center. Now, ask yourselves the question, what it is you want to do with it. Now, yes, definitely high fidelity can be low cost, because fidelity is about, it's about realism. So something is, just because it's an all singing and dancing mannequin, which can breathe, which can change its colors from being well oxygenated to being cyanosed, and you can hear heart sounds and lung sounds and all that. Is that what you really want? Now, you may want to be teaching, for instance, somebody how to break bad news. I can tell you the high fidelity mannequin is useless for it. Whereas your low cost nurse or your low cost actor would be the high fidelity technical person for that particular scenario. So you could just hire an actor, which we've done. These are drama students from our local drama academy who are looking for a bit of experience. They came cheap. In fact, they were trained in drama, so which means they did a very good job of it. So that is an example of no cost, high fidelity actors. Because for breaking bad news, that's what you need. So you might say, okay, but for a technical skill training, for instance, for intubating and for cannulating, I don't think very many people will volunteer to being intubated 100 times. Having said that, you can have a part task trainer. So why do you need a mannequin which costs, let's say 50 lakhs or 25 lakhs or whatever? So you can have a part task trainer. You can have a cannulation arm, which can be tucked under your real actor. So I remember Irene in one of our videos demonstrating a needle phobic patient having a cannulation. And she did a superb job of it. So you would have this part task trainer connected to a real person, and that's again very high fidelity. So you have to ask yourself the question, what is it that you want to achieve? And then from that, you decide what equipment you need. And from that, you decide how you want to create the fidelity. So it's person fidelity, it's technical fidelity, it's environmental fidelity. And again, those are the sort of things we cover in our Train the Trainers course that we run as well. I hope that answers that question. Irene?
Yes, the next two questions, I think I've put something in the chat if you want to have a look. Essentially, I will be saying the same. So the next question says, curious to know, next question is, do you have any model for conducting training needs analysis? I think I've put in the chat box. So there are many models you can follow. Now, what we've been following and has worked every time with us, either we're talking about a course for a specific group of professionals or a whole training series. What we do is simultaneously, we go to different stakeholders. We go to the users of the center or the users of the course, and we conduct a focus group at first with a few people to understand what they feel of training needs are. And then from the results, we analyze these results, and from these results, we open it up to all potential users with a bigger survey. We analyze those results, and simultaneously we go to training program directors or curriculum makers, and we put together all these two different pieces of information, and from then onwards we create our needs analysis, we create our course. The other question is, do you have any model for conducting, how do you measure and compare the outcome of simulation at the summative level? So as I said, we use Kirkpatrick's educational models, as with every other educational activity in medicine. So there are different levels of outcomes you may want to measure. The basic is train user satisfaction, if they enjoyed the course, if they learned out of it, what the perception is of the course. The bigger top level, of course, is transferability of outcomes and patient safety in hospitals. Whether you can create a model to prove transferability and increase safety, probably not to start off with. You will have to satisfy yourselves with the first three levels, like feedback from trainees and feedback from peer review or accreditation centers that can give you feedback. Transferability, you can measure it, but it entails other things and possible difficult processes. And training your faculty, somebody had asked that in the start. I think I've covered most of it. If you still have questions, please ask. But just to say, basic level, as I said, train the trainers for everybody. And top level is in the form of a master's in simulation. When it comes to India, our center is actually creating a master's program for medical education and simulation with one of our partners in India, one of the big universities. We are going to go live in 2023. But if you want more information, we're happy if you come in contact with us to answer individually any questions. So I think...
Yeah, since we are answering questions, can we stop the screen share so that people can view you better? Yeah.
I think I've answered the last three remaining questions.
Yes.
Anything I've missed?
I think there was something about... there's something about summative assessment in that, which I think it might be useful to have a note of caution in there. You know, the thing about simulation is, when we all started in simulation all those years ago, the simulation purists would worry about summative assessment because there's always this worry that what you see in terms of a trainee learner behavior, whether that's truly reflective of what you see in the real world. So I know simulation is now used for summative assessment in exams and OSCEs and things like that. But I would caution against using a single encounter between the learner and the simulated environment as being a pass-fail. So the evidence, if you look at evidence, it says you have to expose somebody to between 8 to 12 scenarios before you actually can decide on a true pass-fail for that particular person. And that's why if you see OSCEs, usually there'll be 8 to 12 in an exam. But when you're running a simulation day, one of the things we do at Hills, which we're very good at, is actually running an immersive day. So it's a day in the life of a junior doctor, it's a day in the life of a nurse. We bring real people into those environments so that you bring an environment or a scenario which is as close as possible to what they will see in the real world. And we try and include the candidates in multiple scenarios, whether they're playing either the first responder or the second responder, or just there in the background. so that we are not making a summative assessment on a one-off performance. So, so that's my only, I think, small piece of advice, that I know, especially with COVID, and we have to catch up on training opportunities, there will be a huge pressure like what we have in nursing right now to replicate or to replace the real world with the simulated world. Just be careful of that and don't fall into the trap. If you're intending to use simulation purely, then make sure that there are multiple exposures rather than a single exposure before you arrive at your outcome. Sorry, Rajkumar, I think you were saying something and I interrupted.
I was just saying that we've been getting great feedback in the chat box, so they're very thankful for the session. They found it very informative. So there are no further questions. If there are any closing comments from the speakers, I think we can conclude.
Okay. So I think it's on behalf of my colleagues, just a huge thank you to those of you who have taken time out. It's an evening from your own time, your social time, family time, to listen to us. And I'm sure my colleagues will be more than happy, like I will, to share our knowledge and our advice and tips. We are all strong simulation supporters. We want simulation to grow and develop in India. So more than happy to support either with direct chats or with emails. So please feel free to contact us. And we are more than happy to take forward any connections we have, and more than happy to share what we have learned over the last decade or so. So thank you very much to the Simulation Society of India for this opportunity. And thank you to Rajkumar for this wonderful webinar. Thank you.
Thank you, ma'am. Thank you, Donna. Thank you, and Irene. And it's very nice to have you all from the UK. This took a while to coordinate. I'm very thankful, Dr. Bua, for being patient with us because we had to postpone it once. And we've had over 120 viewers at any given point watching this webinar. So that's a big number. I've already submitted the feedback form in the chat box. Please submit your feedback. And once you click submit, you'll automatically get an email with your attendance certificate. And we'd love to hear your honest thoughts on this webinar and how we can go about improving the webinars that we're doing. We hope that this webinar will be a prelude to a future workshop where we can teach you how to set up a simulation center with a component of the National Medical Council and what the NMC mandates for the Indian subcontinent, just like the GMC does for the UK. So that is something we hope to do in the future. So thank you all for your time again. We hope to catch you next month with another interesting webinar. And any questions that you feel that can be answered better, please write to us. I've shared my email ID in the chat box. We will take it forward to the speakers here as well, so they can answer your questions. So thank you all. We'll see you again in the next webinar. Good night.